Hearing none, all those in favor? Aye.
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 Any opposed? Hearing none, the ayes have it. Thank you. All right, we'll move on to item number 5, update on COVID-19. Mr. Lee, go ahead.
All right. Well, good morning, Chairman, members of the board. Again, thank you for the opportunity to give a brief update on the COVID response in Navajo County. And after many, many months, I finally have positive news to report. You know, our sacrifices, our actions, they're paying off. Our numbers over the past couple of weeks have significantly lowered. We are trending in a much more positive direction. And, you know, this is not, again, time for the victory lap, but it is time to pat ourselves on the back a little. So I really just wanted to say thank you really quick to everybody in Navajo County that, you know, our actions are paying off. We have slowed the spread of COVID in Navajo County. But while things are moving in a positive direction, we don't want to slip up. We need to continue to follow the personal precautionary measures, physically distancing, wearing a mask when you can't, staying home when possible, staying home when sick. If we continue to follow these measures, we will continue to trend in the positive direction. We've seen what even just a small lapse in our actions can cause. In late May, early June, and through July, we had a significant rise in cases and put a real stress on the healthcare system because of some actions that we took in late May. So again, it's time to take a little bit of a time to celebrate this win, but there's still more to do. Additionally, now is the time to start thinking about flu season and planning for that. The health department, along with many of our healthcare partners, are scheduled to receive the flu vaccine within the next 2 to 3 weeks. This year, more than any, it is crucial that we all get our flu vaccination. We want to avoid another stressor on the healthcare system and the potential for a flu COVID co-infection. So please reach out to the health department, your primary healthcare provider, to schedule yours and your family's flu vaccinations. And with that, I'd be happy to answer any questions.
Any questions, comments for Jeff?
Do you have some real numbers you can share with us, Jeff, this morning?
I do. So as of this morning, the total cases in Navajo County are 5,523. The total cases for Arizona is 199,273. And if we look back, you know, for the past 45 days, we'll see that those first 30 days, we were seeing an average in Navajo County of anywhere between, you know, 50 to 80 new cases a day. If we look at the last 2 weeks, we are looking at an average of 6 new cases a day. So seeing when and how some of the executive orders were put in place, the timing for the incubation period, we really have made a significant difference and moved in a much positive direction with the actions that we've taken.
Thanks for sharing that. I appreciate it.
Thank you.
Any more comments or questions? Okay. Jeff, thanks for your presentation today. What I think I heard you say was that we've got great news, but we're not doing a victory lap. Is that kind of what I heard from you?
That's correct.
Does that sound familiar? All right. Thank you very much for your update. Thank you. Go ahead.
Yeah. Jeff, if you could, in comparing it with other counties, how are we doing in comparison with the others in Arizona?
Thank you, Supervisor Thompson. We're doing very well. You know, Northern Arizona as a whole is doing very well. You know, Navajo County, Apache County, Coconino County, Yavapai County, and even Mojave County, our numbers started trending downward much sooner than the you know, central and southern counties. As a state as a whole, we're doing really well too, but you know, compared to, you know, if we look at Navajo compared to Yuma County or Pima County, we've had a much faster reduction in new cases than the other counties. So I contribute that to the actions and the sacrifices that everybody has taken up here and how seriously we've taken those precautionary measures.
Thank you very much. And that's, if everybody continues to do that, we'll be able to go through it more at ease. So again, thank you very much, Jeff.
Thank you.
Thank you, Supervisor Thompson. Thank you, Jeff, for your response. Other questions, comments for Jeff? Okay, hearing none. Jeff, thank you for the items you presented as well as for the update. I appreciate all that you're doing. If you'll relay that to your team, it'd be greatly appreciated.
I will. Thank you.
All right. At this point, Chair would entertain a motion to return to regular session.
I'll make a motion to move to regular session.
Second.
Okay, we have a motion by Supervisor Thompson, a second by Supervisor Whitesinger. All those